Hey guys, it's Sabrina here. Welcome back to my channel. So for today's video, I wanted to do my skincare routine with you guys. And as I'm doing it, I will be discussing some of the bumps in the road that I experienced with my son during the induction period, which is the first 28 days, 30 days, 31 days in the hospital. So the first phase of treatment for leukemia, ALL, B-cell type. I have no idea for what the treatment is for other types. And the protocols, I can only handle one, honestly. So I'm not as informed on the others, but yeah, I will definitely go over those today with you guys. I just want to talk a little bit about the issues that we have experienced, and they were not light issues. I mean, when we talk about leukemia treatment, you have to understand our worst enemy and the worst problem possible is really the complications of treatment, so more so than leukemia itself. When you, of course, if you keep it under control and leukemia is in control and towards a remission, of course, that's a big, it's like a big step, towards the direction of full recovery and maybe cure. And so, of course, you don't want to deal with the cancer. You want the cancer to go away. You want to go into remission. So that's already a big weight to lift it from your shoulders. However, the treatment is the one that you have to be scared of during this process. The treatment complications, they're coming from the use of these medications or the infections related to, like a consequent to these treatments that bring you to a level of compromise that it's like unheard of, that no human being should go through. So you're extremely immunocompromised, especially with leukemia, because the leukemia is specifically involving the immune system. It's basically the main protagonist of the leukemia is the white cells. The white cells are the ones that govern the immune systems. Our immune system. So of course, that's the one that's being attacked. So in case of leukemia, the treatments are very harsh. And like I said, I'm not discounting that other treatments, other cancer types can be harsh, but I'm just saying that leukemia specifically compromised the immune system. It's a trait of the leukemia treatment. Okay, so having said that, let's move on with the skincare. I'll tell you more about it. So I will say, the first week, it was so messy. I was not there. My head was not there. And, it just was very stressful. And I was not in control. I was really with my son and everything, but I was trusting the nurses and the doctors. And honest to God, I was not doing my homework. I was like so depressed and everything. So the first week was tough. And then what happened is that the fact that he had such a high volume of and number of white cells was a problem, because of course you had to kill them, but after killing them you had to flush them out, so you had to remove them. And to do that, you have to put a ton of liquids in him, and he has to pee. And he did. The problem is, it was getting out of control. The diapers, I was trying to set an alarm, and sometimes I was so tired, I wouldn't wake up. It was just a mess. So sometimes I would change diapers every 2 hours, but technically sometimes every hour. They needed to be changed pretty fast because it was leaking all over. And unfortunately, that caused an issue, which is an infection. Where they extracted some of the bone marrow, of course, they performed biopsy. And of course, it's a very sensitive area for a immunocompromised individual that has no way of fighting infections. And so what happened is that the section where the biopsy was performed, the puncture, got infected. Because of the extreme amount of pee that he was producing, he would leak everywhere. And so that happened. Firstly, it was a cyst, and if I have a picture on my phone, I will put it on this video to show you. So it was a cyst. It was the antibiotic alone drained it. It didn't need drainage at all. So it was a cyst. And then, after the cyst went away, a pimple came with pus. So that means there is an infection. Looked like a pimple initially, but then after a week, after 5 days, it developed into a fungal infection, which was a yeast infection. And that was pretty problematic. That was pretty problematic, you know, in the sense that I was freaking out, so to speak. And basically, they immediately acted on it. They immediately started managing it, and from the beginning, they started medicating it topically, but also with the antibiotics. They identified the type of infection, which is called Candida infection. Candida is the type of fungus. So, yeah. So that's what he was fighting. And he was fighting with this fungal infection for 4 weeks. Even after discharge, we were still maintaining it. It was gone. There was no drainage. The infection was gone, but it was still like healing. So I had to put medication and stuff as it healed, and it closed. Once it closed, everything was good. He still has a scar from that yeast infection, so in his back. So, you know, that was pretty traumatic because, you know, for once, I was more afraid of the infection than the leukemia, which is absurd to me. So, yeah. Like, what's more scarier than cancer? Well, infections, because those are deadly. If they're out of control, they're deadly. And that's the problem here, in the fact that it's not the leukemia. Everyone can administer the chemo. It's the management of the chemo, the management of the side effects, the management of the treatment complications. And infections are a complication of treatment. I know some people that die from leukemia tend to get infections eventually on their own, within their own bodies, but this is a complication of treatment, of course. So yeah, so that was fun. That was terrible, so to speak. It was horrible. It was horrible. I was very upset about it initially. The doctor was upset initially because she said it never happened to her before. And now she has to be afraid of diapers. You know, it's not that she has had patients. It's not the one oncologist, by the way, it's a team of oncologists, but the one oncologist that was on rotation during that week, she was upset. I mean, you can tell she was upset about that infection because you don't like to see children suffer, you know, going through this. It is kind of like unpredictable and it's dangerous. So anyway, but it was always superficial, which is the good thing. It was always superficial. It never became anything more than a fungal infection on a superficial level. It never penetrated below the surface. It was always on the surface level. So like I said, it never spread. So that's good, because if it spreads, it's a big shit. If it goes into the blood, it's dangerous. So again, it's about controlling and management of the symptoms and the side effects of treatment, as you know, and managing all the complications. So yeah, so infections are very common during treatment. So anyway, so yeah, I have to say, so besides that, another event was the walking and the constipation. Constipation was always an issue. I mean, he was on Miralax all the time. He's still on Miralax. It's still an issue, and it's something that we still have to monitor. With regards to the walking, so he was limping at the time when we went to the hospital, and he still was limping. He was walking better, but he was still limping and afraid, and we couldn't figure out exactly what it was happening, if he was in pain or anything. Of course, the leukemia could be a complication of a treatment, because, you know, there's some chemos, there's some medications that cause some weakness on the joints. So it's possible he was experiencing that. My son is not completely verbal. Like, he is verbal. He has a speech delay, so he says some words and stuff. So he's not verbal. He doesn't say phrases. He's not even 3 years old. So it's very hard, for him to express his feelings, to express the pain, or where it hurts him and everything. So it's difficult to understand what was happening, and we couldn't figure out what it was. If it was definitely, we didn't suspect it was leukemia, just because from the test, the test didn't represent something like the leukemia cells were still present, that they weren't a quantity that will cause it. What we suspect it was, besides weakness, of course, or the chemo side effects, like the pain in the joints and stuff, it was the fact that the leukemic cells were so packed in his bone marrow. 99% were leukemic cells, that sometimes being packed, they crunched like this and all like this, like little stones, they could cause small fractures in the bone marrow. And because of that, and they are so small that then they cannot recover on their own. And because of that, it's kind of painful to walk. So he needs a little bit of rest and more time. And eventually he went to, and by the fifth week, I guess, he was walking normally. He was not running, but he was walking normally. And his mobility was much better, and that was also improved. So now he's walking fantastic. It's normal. He's running. He's like his old self. So I'm very happy about it. But yeah, so these were the main complications. I guess some of the advices that I can give you if you're going through this and your son or your daughter wears a diaper. I will say, make sure you have an alarm set up. Don't trust only the nurses. They will do that for you. They will. It's actually, part of their job to help you through this process. But at the end of the day, it's your child. And what I would advise is to put a freaking alarm and wake up to change the diaper so that you don't fall asleep completely and they just let the time pass. And so when it's too late, then it will just go all over the place, especially when there's open wounds in his body or in their body, because these areas can get infected pretty easily. Now, during the first period of the induction, I would say another event was the contraction of some viruses, like in cold, influenza. He had some fevers. He had fevers also because of the infection in his back, but he had influenza. And then, what else? So he had these viruses. I don't know where he got them from. He was isolating them, but, people coming in and out from the nurses, they can carry germs as well from other patients. You never know. In the hospital, you always get things. So that happened, and I got it too. My husband got it too, so we were miserable too. But anyway, but that was medicated, that was treated pretty fairly. He never really went into a respiratory attack or anything. It was always in the throat, in the upper regime, nothing in the lungs. That's about it, really. I don't remember any other complications, really. And like I said, the best advice that I can give you is to check the diapers. Diapers are your enemy, and they harbor infections pretty easily. So I guess those have to be maintained and changed, and you just have to be on top of it. So yeah, take care of your child's butt, especially to avoid diaper rashes, which he hasn't experienced that much during the first cycle, but he has experienced in the future cycle. So I will discuss that in the future videos. But in the first cycle, I guess the most important bumps were the infection is back, and then of course the influenza that he got, the constipation, and the walking, so those are kind of things that are very personal. Now every child goes through these bumps, but those were his, and if those kind of resemble your child's kind of side effects and treatment complications, hopefully that gives you an insight how I kind of went through it and how I experienced them, and how it was corrected in the end, because like I said, that's when you realize, is this the right hospital for my son? Because the treatment is the same everywhere. It's about management of complications and the team's work that make an impact on the outcome and the prognosis in the end, because you have to be feeling comfortable where you're bringing your child to. And I guess I was very disappointed in the infection. When you got infection, made me question on the team and everything, but at the end of the day, they managed it like champion, and I regained trust. And at the end of the day, I cannot blame them. As much as I cannot blame myself, in the sense that I cannot control everything, they cannot control the environment 100%. It could have been the fact that my son was always in bed, and of course it's the back. By staying in this position for a very long time, you could sweat, and the sweat of course causes infections too, you know. So his own bacteria was the enemy during the first 30 days. So that is what I understood, I realized. But anyway, guys, thank you so much for watching. I just wanted to give you like a rundown of, like I said, of the induction periods concerns, and those are kind of his experiences. In the next video, I actually want to talk about other things, more family drama related issues. So those are more involving my son, which of course is the star of the show, obviously, because he's the one that's getting the treatment, and the one that I want to talk about, because, you know, he's the one that is being subjected to all this treatment, and he can, in this experience and what I'm witnessing, can help other people they're going through this hell. Anyway, I hope you like this video, and thank you so much for watching, and I'll see you guys next time. Bye.